Did you know 1 in 33 babies are born with birth defects? But here's the good news. There are few birth defects which are preventable. Today, let us understand what are birth defects, how many types they are, what are the incidences, and how can we prevent these birth defects in our little babies. Birth defects are structural or functional problems seen during the early pregnancy. They can affect how baby looks, how organ works, and how the brain develops. Some of these birth defects are visible soon after the birth, and some get noticed later in the infancy or childhood. Globally, it affects around 3 to 6% of newborns with the birth defects. In India, approximately 7 to 9 lakh newborns are born with the birth defects. These defects will cause illness, disability, and death. That's why they are extremely important to know about it and prevent it. There are three major categories of birth defects: structural defect, functional defect, and genetic defects. Structural defects. Here, the defect occurs during the body organ formation. For example, during the face formation, there can be cleft lip, cleft palate. During the heart development, heart defects, and during the development of kidneys and intestine and the respiratory tract, there can be few anomalies, as well as neural tubule defects like meningocele, meningomyelocele, and spina bifida. All these birth defects occur during early pregnancy, around 6 to 8 weeks, before the woman knows that she is pregnant. Second is the functional defects. Here, the function of the body or the brain is defective, though the structure looks normal. For example, intellectual disability, autism spectrum disorders, hearing problems, vision problem, and certain metabolic disorders. These defects can occur later on in the infancy or during the childbirth also. They may become noticeable during infancy or during childhood period. Third is the genetic defects. Here the defect occurs in the genes or the chromosome. For example, Down syndrome, certain syndromes, and thalassemia and congenital inherited metabolic disorders. Here it can be directly inherited from the parents, or there can be spontaneous gene defect during the conception time. Now here's the most important part. Not all the birth defects can be prevented. Few can be significantly reduced with proper planning, medical care, and attention. Many parents ask me, "Doctor, can the birth defects be prevented?" Yes, few can be prevented. There are few certain precautions which has to be taken before the pregnancy and during the pregnancy, because all these birth defects occur very early period, around 6 to 8 weeks of pregnancy. One of the most single proven intervention is folic acid. Tablet folic acid has to be consumed 1 month before the conception and continued during early pregnancy. This itself prevents 70% of neural tube defects like spina bifida. Second is controlling medical conditions like diabetes, hypertension, and certain autoimmune diseases. If these are poorly controlled, then it leads to complication in the fetus. So that is why maternal conditions, morbidities has to be controlled very well to prevent the fetal birth defects. Third is prevention of infections during the pregnancy. Certain infections like rubella, toxoplasmosis, cytomegalovirus infection, syphilis can be prevented. This involves screening and vaccination before the pregnancy and proper hand hygiene. Fourth one is avoiding harmful substances like tobacco, smoking, alcohol, and certain narcotic drugs. These have growth effects on the baby and have brain developmental defects also. That's why avoiding these harmful substances is very important. I've seen many mothers, they self-medicate themselves whenever they have some fever, cold cough, or any other illness. So never self-medicate during pregnancy. Always consult your doctor. because not all medicines are safe. Certain medicines are teratogenic, that means they cause birth defects. That is why use drugs safely. Next is the genetic counseling. A parent has a birth defect, or there is a family history of birth defect, or previous sibling was a congenital anomaly, or the parents are married in a blood relative, then they need to undergo genetic counseling, because this helps in early screening, early diagnosis and informed decision making. Overall, a pregnant woman should have a healthy lifestyle and healthy diet, like consumption of iron, vitamin B12, folic acid, iodine, protein and balanced diet, because this itself will cause anemia and malnutrition, and it affects the baby's birth weight and developmental issues. So the key take-home message is, not all birth defects are preventable, but many are. It involves proper planning, medical care, awareness and nutrition. A healthy baby doesn't start in the delivery room, it starts before pregnancy itself. If this video was helpful, then please share it to the parents who are planning for conception or are there in their early pregnancy period. Thank you.